I think what's important to keep in mind is that all hip approaches, every way that you get to the hip, they all work really pretty well. The hip replacement is probably the most successful operation in the history of medicine when it's done for the right reasons, and it's a very good pain relieving operation. And so where anterior hip replacement fits in to the kind of thought process, or how hip surgeons have become interested in this, is that we've taken something that was really, really great no matter how you did it, and now we're just trying to make it even just a little bit better. And so what's nice about the anterior hip approach is the muscles there is a natural plane where you can get to the front of the hip between muscles without detaching any muscles, and you can take advantage of that, make it to the capsule level, and then this is what is the portion of the procedure that requires a lot of repetition and a lot of practice to become proficient. But working within that capsule and placement of the retractors and positioning of the extremity to safely gain access to what you need to do the work, that's the sort of the secret sauce to success with this, and that's what works really well. So people tend to, I think, bounce back from that really pretty quickly. They have a lot less discomfort. We do a lot of the procedures and people are home within a few hours of the operation, so there's not a real prolonged downtime and no prolonged hospitalization with the operation, because pain control is not really an issue. They're generally really comfortable after the operation. We have people that go through it routinely and take only Tylenol for pain control. The nice thing about anterior hip replacement is that when the posterior capsule, the capsule on the back of the hip, is not disrupted, then those hips are very stable. And so if you've had a traditional approach, those hips, because that capsular tissue has been disrupted, they have a tendency to dislocate. And so you have to follow precautions for the entirety of the time that you have that hip replacement. And there's even an incidence of late hip dislocation with those approaches. So the anterior hip is a stable hip, and so I don't have people follow any precautions. They can just treat it like normal, and we've had great success with that.